Welcome back. During December last year, the Ministry of Health and Social Services rolled out an immunization campaign for measles and rubella. In a press statement, the ministry said that a total of 253,738 children were immunized, which represents about 95% of the targeted immunizations of children between 9 and 59 months. Joining us this evening is Mr. Nicholaus Shapumba, the National Immunization Officer in the Ministry of Health. He joins us to expound on the progress of the immunization survey. So good evening and welcome.
Thank you for having me.
Thank you for being here. To start with, has the entire immunization survey run its course? And if not, which areas in Namibia were not reached during the initial drive?
Yes, in the initial drive, we were targeting all the health districts in the country. That is 36 health districts. So we managed to complete or to achieve the target in 7 of the health districts. So the rest of the districts, they were half done. That's why we need to go back and complete those remaining ones.
Talk to us, Mr. Shapumba, about the objective of the survey that the ministry is currently undertaking.
Yes, the survey is twofold. Remember, we are having the campaign that you referred to that we conducted last year, the measles rubella vaccination campaign. And then we also have our routine vaccination campaign that we are doing on a daily basis at each health facilities, public health facilities. So now the coverage survey is to validate the data that we are reporting on a routine basis. So it's a survey. So routinely we are collecting data on vaccination. Now we need to validate the data. So the same with the campaign data that we collected during the vaccination campaign, we also want to validate that through the coverage survey that we are continuing to conduct. Yes.
Why is it so important that the population is immunized against measles and rubella?
Yes, measles and rubella diseases that are affecting, of course, everyone, but more dangerous in childhood. So the aim of the vaccination program is to protect the children. So we want the higher coverage in children in order to allow the children to develop immunity against the diseases that we are targeting. So now if you have a high coverage, it means your children are protected. So the country is targeting 95 vaccination coverage in the childhood vaccination. So when you are below that target, it means your children are not protected. They are prone to infectious diseases like now measles that we are targeting.
Yeah. Just in layman's terms and for our viewers to properly understand, when you say high coverage, what do you mean by that?
It means that a higher percentage of the children, they are vaccinated. So, which means 90% of
and above.
Yes, and above. So that's now where you say, my children or my population is protected. Yes.
Fantastic. And you mentioned that this campaign is specifically aimed at children. So what age group are we targeting here?
Yes. Right now we are not conducting the campaign. We are conducting the coverage survey in order to validate what we have done in the past in routine vaccination, but also in the vaccination campaign that we conducted. So we are validating. In other words, we are going down there and check the children whether they have records of vaccination. And we also ask the parents and the caregivers to give us evidence that no, my child or my child, the child under my care was vaccinated, either during routine vaccination or during the coverage, the campaign that was conducted in August last year. In August last year.
Yes. With this survey conducted, are there any recommendations that will be made regionally or nationally?
Yes. So, like I said, is to validate the data, the administrative data, and also to find now out what are the gaps, because then the parents and the caregiver will tell us. So, if you find that children, or some of the children are not vaccinated, then you will ask whether why were they not vaccinated? Is it because the service is not available? They were not informed about the service, or they do not know that their children are benefiting from the vaccination that is being given. So now once you have those reasons, of course, you'll maybe make some targeted intervention towards addressing those issues in order to make sure that if they were not be able to perhaps reached by the teams that were there, so then you can perhaps strategize how will I reach them, or if there is no perhaps a outreach points in that facility, then you'll try to establish one so that they're able to reach the points. Actually, is to make sure that everybody else is reached by the vaccination, but then you can hear from them how are we going to do, or how can we do it better.
You mentioned very early on in our conversation that there were 36 areas that the ministry had targeted, and then there's still the areas that you need to go back into. So when will that happen? Yes,
the campaign is, the coverage survey is starting next week, the 10th. We'll have 3 weeks. So the first week, we are going to do the listing of households that we are going to interview. And then once we have completed the listing in the first week, so then we'll continue in the next 2 weeks to do the enumeration. That's now to collect the actual data from the households that we have sampled for enumeration. And then we are targeting now 29 districts, because earlier I indicated that during the last coverage survey, we concluded the 7 health districts. Those ones have reached the target, so we are not going back to those ones, but we will now continue with those ones that have not achieved all the enumeration areas that were supposed to be covered.
So to run from the 10th until which date?
Until the 25th. So that's where we'll complete that.
Mr. Shapumba, are Namibians adequately informed and educated on the importance of immunizations?
Yes, we have I will not say all of them, but we have strategies how we are informing them. One of the platform is this one. So when we are coming here and tell them about vaccination, the importance, where they can get vaccinated. But you also have some challenges. Of course, you have communities that are not able to reach maybe the health services in some areas. They are very remote, but also they perhaps not get more information on the vaccination because of access to information, especially to medias and to all other means of communication. But we have teams on the ground. So our health facilities, they are always communicating, telling them about vaccination. We have outreach teams that are going out there, delivering service, but also talking to the community. We have community health workers that we have deployed in the communities that are talking about vaccination and other health issues. But this is not enough.
Yes. Of course, it never is.
Yes, it's never
Any
enough.
final remarks from you this evening, sir?
Yes, like we are saying, we are deploying teams next week in the community. So what we are asking the public to do is to help us to give the information. We will have teams deployed in the 39 health districts, except 7. And the 7 that we are not going to is Katima Mulilo Health Districts, Okongo in Ohangwena region. We will also not go to Ochivarongo and Okakarara in Osozonjupa, and Aranos in Hardap, and also Onanjokwe and Omthia in Oshikoto regions. So those ones, they are complete. So, and Valfis by in Rongo. So the rest of the health districts, we are going there. So our teams will be in those health districts to do the coverage survey. So we are requesting now the traditional leaders, be them political leaders or church leaders or whoever have heard about this coverage survey, to inform the neighbor or the next person about this coverage survey that will be conducted. So they need to help us to give our teams the information that they are looking for. This will help us a lot to improve the service that we are providing to our community and to the Namibian people.
Sir, thank you so much for your time, and thank you for joining
You're
us
welcome.
this evening.
And thank you for hosting me.
We're going to take a brief break. We'll be right back shortly.